In this video, I'm going to cover what we did as a family with our daughter before we got her into the Airway Palate Expander Maxilla Spreader. In our particular care plan with our Airway orthodontist, Dr. Toro in Lexington, Massachusetts, was determined that we started with a Maxilla Spreader. Myself as a craniosacral therapist, I've worked a lot with people with their maxilla, which is right here, which goes into that part of the eye socket along with the frontal bone, the sphenoid, which comes into this would be the hard palate, into the sphenoid right here. When you're going to go into a maxilla spreader, you're going to be affecting the bottom sinuses, the eye sockets, the ears. So before we started on that maxilla spreader with our daughter, I went through, since she's been born, I was doing craniosacral therapy on her. I released the frontal lobes with the occiput. I did some ear fascial release. I released the thoracic outlet. I released the respiratory diaphragm, the vagus network down through this upper diaphragm, the hips, and the sacrum, also the shins. Anywhere just like this string, if it's pulling down into the shins or into the hips or the sacrum because there's been a tailbone injury or a difficult birth, or you have that kid that has almost no hamstring length, this neural tension that's down here, when you're going to start to ask the whole maxilla to change and the cranial base to consent to that. And really that's what it's about. When you have the maxilla spreader and you put more pressure on it, you go to a sport, you're asking for spinal cord level consent of, hey, I have an anchor down into my shins and my ankles are not budging, pulling all the way up to this cord. And then if you're just going to go and pull up here, it's just not going to go well. My opinion, if you have a professional in your area, on my website, visit my website. I have links to both integrative manual therapists in your area, the Barral Institute and Upledger Institute. Those are people that I know they're training, and I know they've had advanced training to look at the whole body. You're not just talking about the jaw and the airway up here. That being said, would be if your kid has already had cavities, if they have a high sugar processed diet, if they're not getting EPA, DHA. EPA, DHA, the fat is going to help that lining around each nerve sheath as well as the whole dural membrane. What's the dural membrane? Well, have you had a spinal tap or an epidural, or you've heard of the medications that cross the blood-brain barrier, which are addictive usually? That's that membrane that's going to be inside here, wrapping around the spinal cord as it comes out here, and it goes all the way down to your sacrum. And that epineurium keeps going down the sciatic network. Anywhere along that dural tube area that's pulling, when you ask that body to shift, you're affecting that membrane. What we did with our daughter, I made sure that she didn't have any neural tension down into her shins. I made sure that she didn't have adherence of the hip like this, flinching into the pelvic floor, which the best way that I found to get that was to make sure that I did a myofascial release to the sacrum. And if you release the sacrum, then you have less of that anchoring pulling down here. So then your child's body will have the ability to elongate the skull. If you don't have the ability for the dura to elongate, then you're probably going to use your accessory nerve to slack the nerves this way. They might turn their feet out. They might have been toe walkers as toddlers. If they have that chronic ear infection, or if they had a lot of that as kids, or they had tubes, you're going to want to really make sure you have a temporal fascial release done, the thoracic outlet done. For other people, we got her going on myofunctional exercises. My personal favorites for those is holding the tongue with a towel, pulling it and stretching it to the front, and then stretching it to the side. You're holding for a bit of time, maybe just say 10 seconds, and then to the other side. Another one I like that my daughter will do is you take your tongue to the upper back molars, and then you slide your tongue all the way around the front of your teeth to the back molars. And you do that, taking your time nice and slow. And you're looking to unwind basically where the hard palate joins the soft palate in the back. That fascia and muscles back in through there is what's going to help you also not do what many people do, and what many people that I've seen on my table with complex headaches and neck injuries do, which is to, okay, you're going to ask me to elongate this, but I have tight hamstrings and sciatic neural tension, so I'm going to do this and this to shorten for you. Your body's going to give you what you're asking for. If you're aggressively asking for the teeth to shift and the jaw to shift, but maybe you have an inflamed nervous system because of stress, lack of sleep, not enough hydration, not having electrolytes, having a history of infection, having a history of a traumatic birth or concussions that you didn't have addressed with a craniosacral therapist or a concussion specialist, doing that eye tracking exercises, which can have a nice inhibitory effect on the spinal cord. Those are the kids that are going to be at risk. What you could do with your child right now, no matter what age you're at, whether you're doing airway orthodontia or not, is if you're looking at their posture, which you really start to see parents bring their kids to me with the goal of better posture. Some of that did start early with the growth spurts. Our daughter has this really long spine. She's growing like crazy, which is another reason why I decided to get her to the orthodontist, because your body's going to pay attention to that growth spurt, but it might not be able to accommodate for this. No matter what age your child is or what's going on with them biomechanically, we have one chance to get their spine right to their fullest potential while they're with us under our care, having a reverence with what you're asking of the body. If you're having a big ask of the body of rearranging the bones of the face, it's a low glycemic diet. It's idealizing sleep. It's not being aggressive. The adjustments, it's not being aggressive with sports after adjustments. Unwinding neural tension that's down further away from the spine. Therefore, there's more slack in the system to really allow that jaw, airway, tongue muscles to perform with your myofunctional exercises. That's what we did first with our daughter. You can look at my other videos where I show you how to do a temporal fascial release, pectoral, respiratory diaphragm. I'll teach you all the skills that you could possibly use at home with your child under your care. And also, like I said, I vetted on my website referral sites for people that could help you professionally.